So on this page, the vast majority of videos are intended for the general public, but occasionally I post something especially for clinicians, and this is one of those. I've done a video on how clients can make the most of virtual therapy conducted remotely by video conferencing or telephone. And most of those same tips apply to the therapist as well. So I'd recommend you take a look at that video and think about your own practice. But there are some extra tips for therapists to think about, and I'll also repeat some of the ones from that other video just for emphasis. First, I like to space my remote session appointments just a little bit more than when I'm doing in-person therapy. Most therapy sessions are 50 minutes long, so you can book people on the hour, 9 o'clock, 10 o'clock, 11 o'clock, and then you use that 10 minutes to, reorganize your office or take a washroom break, do anything else you need to do so that you're ready for your next person. But in remote therapy, there are sometimes glitches or sound problems or connection difficulties on top of everything else. And I don't want to penalize my client if their internet freezes on them or something. So I generally schedule appointments an hour and 15 minutes apart when I'm working remotely. I think I'm in the minority there, so feel free to ignore that idea if you must, but it works well for me. Next, think about your height relative to your client. None of us would choose to be seated up on a very high stool looking down at the client for the session, right? We want to be on the same level. That's why most of us use office chairs with a variable height adjust, right? At the start of every session, the client comes in, sits down, I sit in my chair, and I automatically reach below the seat and I adjust the height so that the client and I are at eye level. But right now, like literally right now, look into your computer camera. Are you looking up or down or straight on? It should be pretty close to straight on, not to the screen, but to the camera. So I have a box at the back of my desk, and as I'm starting a session, I lift the computer up onto it. My eyes don't have to be at the middle of the screen, remember, just at the level of the camera itself. Now, I also don't want to be too close. Most of my clients are using their computers, so the screen is a good size, and I encourage clients to use a computer, not their phone. But if I'm a foot away from the camera, the client is staring at every pore, and it can feel like I'm invading their personal space. Sit back a bit. You want them to be able to see your hands if you're gesturing. So ideally, you should be far enough back that they can see at least to mid-chest level and maybe a little bit below that. Next, consider your background. What's behind you? Now, maybe you don't usually practice remotely, so you're making do with some space you wouldn't usually use. Stage manage your background a little bit. Now, most YouTubers seem to shoot their stuff sitting on their bed. Now, frankly, it's a little weird having your clients look at your bedroom, so don't do that. One of the clinicians at my clinic has a really great backdrop. There's a wide landscape style piece of very simple art framed behind him, and on one side is his degree, which is a nice, tasteful looking thing, unlike my graduate schools, which I think you can see back on the wall there. They made these huge ones. And on the other side is his license from the college. Lovely. You don't want the wall of qualifications and awards to intimidate the client. Look what a big expert I am. Don't you dare question me. We don't want that. But his arrangement is lovely. Okay. Now, some of you are working in front of bookshelves. That's fine. But it can look a little busy and distracting. And do take a look at the books there. Like what books are in screen when your client is looking at you. If it's your kid's Harry Potter collection, well, that just may not look very professional. Now, I've seen some people use those green screen effects with them sitting in front of the Eiffel Tower or something. Now, there's probably a way to make that not look cheesy, but I have yet to find a therapist who has managed to accomplish that, right? No one I've seen has found it. And it does these weird things where your arm suddenly disappears or you lose your nose if you turn too quickly. Listen, get rid of those backgrounds. If the client uses it, fine, whatever. But I don't think a therapist should use an artificial background. Okay, maybe you're completely alone in your office suite or at home. So you have absolutely complete privacy. How does your client know that? They don't. If they look past you and they see an open doorway, like right behind the right behind you, they might wonder if somebody near you might be able to hear everything they say. Maybe there's somebody in the next room who's listening in on their session. Now that might be, overtly they actually think that, or it might be outside their conscious awareness. There's just this weird feeling of insecurity they have. So close that door. It doesn't matter if there's nobody behind it who can hear you. Your clients don't know that. It might even be a good idea to shift your frame a little bit so that they can see that the door to your room is closed. Now, clients are also used to video conferencing that freezes or glitches every so often. So partly they're doing their session, but partly they're also wondering, are you actually hearing me? Are you actually getting this? Now, maybe they're telling this really, really important personal story and you're not even hearing it. So they're looking at you on the screen to see if you've frozen. If you're sitting extremely still, as you might in your office, they can't tell whether you've frozen or not. So if they're talking at length about something, I make a point of gently turning my swivel chair or my head, moving my head a little bit, much like you do normally when you're listening, but even a little bit more so. Just ramp that up just a bit. And it's best, of course, if that's slow. You don't want to be distracting or look like secretly you just need to go to the bathroom, but you want them to see that you're really there. Sharp, sudden movements are distracting and they pull your client out of a focus on their own experience. But slow, reasonably continuous movements are less of a problem. Next, eye contact, which is something we're really conscious of in in-person therapy. And when you're doing remote therapy, you want to really get past or through the boundary or barrier of the technology. So it's tempting to stare at the client, but that's not the camera. Try to cultivate a relaxed, wide field of view, and when you'd ordinarily want eye contact, look directly into the camera, not at the screen. You'll still be able to see the client in your lower periphery, but make camera viewing a frequent habit. Next, nonverbals. The technology often glitches a bit when people talk over each other. And when you're both in the office, it isn't too much of an issue when you both start talking at the same time. You usually just shut up and give the floor to them. But you might be blocking sound and you'll miss a few of their words every time you break in with an aha or I see or tell me more or I don't understand or what have you. So what I suggest is that you ramp down your ahas and oh yeahs, that kind of thing, what they called minimal encouragers in my interviewing course many years ago, and ramp up and diversify your nonverbal encouragers. So nodding is one way. but you don't want to look like one of those nodding dogs in the back of a car, right? So subtle shifts in your posture, touching your face, God forbid, in this day of COVID, looking confused or looking enlightened, or tilting your head to ask for more information, or straightening up, or looking dejected. They're telling you a story about something disappointing that happened, and you're, putting on a dejected expression rather than saying, "Oh my gosh, I'm so sorry that that happened." All of those are tools that you should have available. I also find I'm using a thumbs up gesture in video therapy to show agreement. I never do that in person. And you might push some of those gestures just a hair more than you would in the office because the client may not pick up on really subtle movements. Normally you might go, on remote therapy, they're not seeing you quite as clearly, so you might have to go like that instead. Now, normally a raised eyebrow or a squint or a glance to the side might do it, but these might not be too visible on the screen. So the challenge, again, is to become more expressive without looking like you're in a silent movie or overacting. Now, that can take some practice. I would also suggest that you be a little directive with your clients. I've had the odd person who's clearly doing the session on their phone, and they're moving around and they're doing other things while they're talking. They're doing the laundry or watering the plants or putting the dog out, and what sometimes suspiciously looks like they're getting texts or emails. That's not surprising. It's the way many of us routinely work on a computer or phone. Let's face it, we have the attention span of a gnat. So I suggest early on talking to your client about how therapy really only works if you can give it your full attention. Recommend that they use the biggest screen that they can, ideally not their phone. Ask them as well to start the session without you by sitting quietly for a bit and thinking about how the week has gone and what they want to do in the coming hour. Remind them that you can't tell whether anyone at their end can hear them or you, so you can't moderate your own volume when somebody happens to pass by the door outside your client. So, tell me more about that sexual issue you were worried about last week. Do they really want somebody hearing that? Work with your client to brainstorm ways of finding some privacy, including scheduling their sessions when nobody's likely to be at home, or having them tell everyone what they're doing and that they need some privacy, or using the most remote or private room or space that they can, or wearing headphones. Now, some people may need to be away from their home altogether. Some of them sit in their garage or in the car or even in the bathroom. These are not ideal, but it may be the best that your client can manage. So, what are your challenges working remotely with clients? Or if you are a client in remote therapy, what do you think your therapist could do just a little bit better? What are they already doing that has helped you to get used to it? Use the comments section below, but remember, if your username is your real name, that'll be public on top of your comment, so do protect your privacy. Thanks for listening.